Have you ever wondered how your body stops bleeding within seconds after a small cut? This video explains platelets and thrombocytopenia in clear visual terms. We will cover what platelets are, how they form inside bone marrow, how they prevent bleeding, and what it means when their numbers fall. We will move step by step: platelet basics, thrombopoiesis or platelet formation, their role in hemostasis, and causes and consequences of thrombocytopenia. Don't forget to subscribe to the channel to stay updated with microbiology, biochemistry, histology, and medical lab techniques videos. Let's begin with the basics: what platelets actually are, and what makes them unique compared to other blood cells. Platelets are tiny nucleate cell fragments circulating in blood that help stop bleeding by initiating clot formation at injury sites. They measure roughly 7.5 to 10.5 femtoliters in volume, extremely small but highly active biologically. Unlike most cells, platelets lack a nucleus, which means they are fragments derived from a larger precursor cell rather than whole cells themselves. Under Romanowski stain microscopy, platelets appear as small bluish-gray structures with scattered reddish granules and frequently clumped together visually. Despite their size, platelets are essential for hemostasis, the coordinated process that prevents excessive bleeding after vessel injury. Next, we will look at how these fragments are born inside bone marrow through a process called thrombopoiesis. Thrombopoiesis begins with hematopoietic stem cells in marrow that differentiate into megakaryocyte precursors under specific growth signals. Megakaryocytes are large polyploid cells that undergo cytoplasmic maturation, expanding their internal membrane systems to prepare for platelet production. Long cytoplasmic extensions called proplatelets protrude into marrow sinusoids, where blood flow fragments them into platelets that enter circulation. Thrombopoietin is the primary hormone regulating platelet production, signaling megakaryocytes to increase platelet output when needed. Daily platelet production balances clearance. Normally, bone marrow continuously replenishes platelets to maintain steady circulating counts. When production, distribution, or survival changes, platelet counts can fall, potentially causing the clinical condition thrombocytopenia. Platelets adhere to exposed collagen at injury sites, activate, release granule contents, and recruit more platelets to form a hemostatic plug. Activated platelets change shape, become sticky, and provide a surface that accelerates coagulation cascade reactions, leading to fibrin stabilization. Together with plasma clotting factors, platelets ensure bleeding is limited and wounds begin to seal efficiently and rapidly. Normal platelet counts typically range to keep this system functioning. Laboratories measure counts to assess bleeding risk and marrow function. Small drops in platelet number may be asymptomatic, but significant reductions can lead to easy bruising, mucosal bleeding, or more serious hemorrhage. Now let's explore causes, diagnosis, and management of thrombocytopenia in a practical clinical context. Thrombocytopenia means an abnormally low platelet count. Causes include decreased production, increased destruction, sequestration, or dilutional effects from transfusion. Decreased production may result from marrow disorders, chemotherapy, or viral infections that suppress megakaryocytes and their precursors. Increased destruction can be immune-mediated, as in immune thrombocytopenia, or consumptive during severe clotting disorders or sepsis. Clinical diagnosis uses history, physical exam, peripheral smear appearance, platelet count, and sometimes bone marrow studies to determine cause and severity. Treatment depends on cause and severity. Observation for mild cases, immunosuppression for immune causes, platelet transfusions, or thrombopoietin agonists when indicated. In summary, platelets are small but essential fragments formed by megakaryocytes. Maintaining their balance is critical to prevent bleeding complications from thrombocytopenia. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, MRI, and diagnostic imaging, step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.